Hello everyone, today we're going to talk about vaccine of infant with meningococcal Group B vaccine. Well, the definition, meningococcal disease can cause meningitis, infection of the lining of the brain and spinal cord, an infection of the blood. Even when it's treated, meningococcal disease kills 10 to 15 infected people out of the 100.
Meningococci are commonly carried asymptomatically in the nasopharynx. Virulent, invasive forms of the bacteria may overcome host defenses and adhere to epithelial cells. Mucosal invasion and transcytosis allows entry of the bacteria into the bloodstream. Here, the bacteria may cause life-threatening septicemia as they multiply to high density and shed outer membrane in the form of vesicles or blebs, causing the host to release inflammatory mediators and cytokines. From the bloodstream, the bacteria can also cross the blood-brain barrier to cause meningitis.
Application in medicine. We have meningococcal B vaccine can help protect against meningococcal disease caused by serogroup B. A different meningococcal vaccine is available that can help protect against serogroup A, C, W, and Y.
Meningococcal disease is rare, but very serious, and you can protect yourself from it. The meningococcal ACWY vaccine helps protect against disease caused by 4 types of meningococcal bacteria, A, C, W, and Y. Meningococcal disease occurs when meningococcal bacteria, commonly found in the nose or throat, invades the body and causes serious disease. It's more common for older teenagers and young adults to carry bacteria and spread it to others. Although the majority of people will recover if the infection is diagnosed early, the disease can cause complications that may result in permanent disabilities through limb loss, deafness, blindness, scarring, kidney or liver failure, and sometimes it can even cause death. The vaccine is provided free in schools for young people in Year 10. And if you did not receive the vaccine at school, there's no need to worry. Speak to your GP or school-based immunisation provider about how you can catch up. The vaccine is free up to 19 years of age. In Australia, all vaccines must meet very high safety standards. Like with all vaccines, a small number of people can have a reaction. These are usually mild though, and can include soreness and swelling or redness at the injection site. If you have any concerns, seek medical advice. Meningococcal disease is serious, but the good news is you can be protected. To get your vaccine, all you need to do is return your consent form to your school after it's been signed by your parent or guardian.
Now, pros and cons. Pros. For best protection, more than 1 dose of meningococcal B vaccine is needed. There are 2 meningococcal B vaccines available. The same vaccine must be used for all doses. Cons. Soreness, redness or swelling, whereas shot if given. Tiredness, fatigue, head, muscle and joint pain, fever, chills, and nausea or diarrhea can happen after a meningococcal B vaccine.
Parents of preteens and teens have been asking me some pointed questions about the vaccination their older children are supposed to get to protect them against a certain type of meningitis. Well, let me take my best shot at telling you all about what we call the meningococcal vaccine. The meningococcal vaccine is designed to target against a bacterial germ called the meningococcus. It's a pretty serious germ because if it gets into your bloodstream, it can cause a life-threatening condition we refer to as septic shock. And if it gets into the fluid between your brain and spinal cord, then it can cause meningitis. How could your child get this organism? Well, they would get it by close respiratory contact, by kissing, by coughing on each other, by sharing eating or drinking utensils. It's for that reason that when kids are in close quarters, such as in a dormitory, at a boarding school, or in college, that we see an increased incidence of meningococcal infection. In fact, 1 in 10 people who get this organism are going to experience a serious complication if they haven't been vaccinated, such as brain damage or even death. The good news is we do have a vaccine to protect your child against this organism as a teenager and as an adult. We call it the meningococcal vaccine, and we tend to give it at age 11 to 12, basically before kids go into close quarters, so it has its effect. We'll give a booster during adolescence, but we can give it at any time. The good news is it protects against most strains of this bacteria, so your child has a much lower chance of ever getting this particular type of infection. Are there side effects? Well, we're not giving the whole germ to your child. We're giving parts and pieces, so your child can mount an immune response. That means they're protected in case the actual germ gets into their body. So what are the side effects? A little soreness at the site of the injection, a low-grade fever for a day, and in rare circumstances, an allergic reaction that is certainly treatable.
Issue apply in Ecuador. We evaluate the effect of vaccination on the incidence of meningococcal Group B disease during the first 3 years of the program. The effect of vaccination was assessed by comparing the observed incidence of disease with the expected incidence based on the incidence during 4-year pre-vaccination period in equivalent cohorts, and with the use of disease trend in cohort of children younger than 5 years of age who were not eligible to receive the vaccine. vaccine effectiveness was estimated with the use of the indirect screening method. Finally, we have the conclusion. The 4CMenB program was associated with continuing positive effects against meningococcal group B disease in children and protection after 3 doses of vaccine was sustained for at least 2 years. Thank you so much for your time.